Well, good afternoon, everyone. It is a pleasure to be here today. I'm Jason Copping, the MLA for Calgary Varsity and Alberta's Minister of Health. And thank you for joining us all here today at Bethany, Calgary for this important announcement. Now, with me today from Bethany are Jennifer McHugh, President and CEO, Dr. Al Kriske, Board Chair, and Jennifer Vance, Registered Nurse and Site Administrator here. We are also joined today by Dr. Catherine Chubbs from the Good Samaritan Society in Edmonton. Now, before I go on any further, I would like to thank Jennifer, the staff, and residents here at Bethany, Calgary for hosting us here today, especially with the residents' art exhibit happening. For those online, you won't be able to see because it's behind the cameras, but the opposite side of the room, there's a tremendous art exhibit, and I'm hoping to speak to a number of the artists in residence later on. So let's get started so then I can tour the gallery in a few moments. Building a resilient and responsive healthcare system is essential to keep Albertans healthy. This is especially important for continuing care residents in the province. Our government is looking for better ways to support Albertans who need continuing care and their families. We also need to strengthen supports for caregivers, healthcare providers, operators, and the staff who provide this high-quality care. Alberta's government is committed to providing better continuing care services throughout the province by making historical investment of $4.3 billion in operational funding for continuing care in Budget 2023. This includes $1 billion for transformation initiatives, many of which were identified in the facility-based continuing care review. Transformation in the system is a huge and complex undertaking. It will impact every area of the continuing care system, so Albertans in all communities receive the quality care they expect and they deserve. This is particularly important because we know the need for continuing care will significantly increase over the next 10 years. The system needs to continually adapt to be more responsive to the evolving needs of Albertans, especially for seniors as they age and their health care needs change. Seniors want to live in their own communities, close to their family and friends. And they also deserve access to the most up-to-date continuing care homes where they can receive personalized care. And that is why I am proud to announce, as part of Budget 2023, the Alberta government has approved a total of $240 million in capital funding for two modernization projects: the Bethany Calgary redevelopment project and the Good Samaritan Village project in Edmonton. The Bethany Care Society will receive a capital grant of $57 million beginning in 2024. This is part of the province's total investment of $114 million over 5 years to support the redevelopment project right here on this site. This funding will support the construction of a modern seniors residence featuring 420 private continuing care spaces. The new complex will also be the beginning of a hub for a campus of care that increases services and supports for the local community. It will also replace the 54-year-old Bethany Calgary Auxiliary Hospital. In Edmonton, the Good Samaritan Society is also receiving $63 million in 2024 to support the Good Samaritan Village project. This funding is part of a total government investment of $126 million over 5 years for the development of a new seniors residence with 280 continuing care spaces. The new complex will have 20 independent households. Each household will be home to 14 continuing care residents living in private rooms, providing each of them an opportunity to make these spaces their homes. The new facility will replace the Good Samaritan Southgate Centre and provide other rooms for other residencies in Edmonton. And the Southgate Centre is one of the oldest long-term care homes in Alberta. Funding these projects makes sense for many reasons. Both projects will fill a need in our two biggest cities for high-quality and sustainable continuing care spaces. These investments also act on recommendations from the Facility-Based Continuing Care Review to replace or upgrade aged facilities. We also need to phase out shared rooms that exist in many care homes in our province. One of the lessons we learned over the past few years is that residents can be better protected from disease, and we can limit the spread of infections if they have their own space. These private spaces also provides them with more opportunity to personalize their space and make it more of a home. Replacing or modernizing aging facilities is the right thing to do. New, modern, home-like settings would support residents' quality of life with even better personalized care. Families can be assured their loved ones would be in a safe, up-to-date residence where they receive specialized care and supports. You can see why funding these projects is so important for people in Calgary and Edmonton. Through these investments, I believe we are on track to strengthening the continuing care system now and in the years to come. We will continue to work with our healthcare system partners, like the Bethany Care Society and the Good Samaritan Society, to deliver innovative continuing care approaches and supports. I am confident that all this work combined will make our continuing care system more sustainable and improve outcomes for those accessing care. So once again, I want to thank the staff here at Bethany and the staff at the Good Samaritan Society and all those working in continuing care homes across our entire province for all the tremendous work that you do each and every day. We value your dedication and passion for the work you do. So once again, thank you for everyone providing care for Albertans. And now I'd like to pass over the mic to Jennifer McHugh, the CEO at Bethany, to say a few words. Thank you.
Well, this is a great day for Bethany and a great day for continuing care. On behalf of our organization, I would like to welcome you all to Bethany Calgary. For more than 77 years, Bethany has operated as a not-for-profit, faith-based provider of continuing care, housing, and community services for seniors and adults with disabilities. Our mission is simple but impactful: creating caring communities. Today, Bethany operates 24 locations across 8 different communities in the province. Bethany Calgary is one of the oldest care centers in Alberta. It's also where our organization first began in 1945, with a 19-bed care home on this site. Now, over 400 residents call Bethany Calgary home and receive 24-hour-a-day care and support from our multidisciplinary teams. Although it has gone through many renovations since its inception as an auxiliary hospital in 1969, this building no longer meets the modern standards and best practice designs for care environments. We are grateful to see Bethany Calgary included in the Government of Alberta's plan to strengthen healthcare and the importance that continuing care plays in ensuring a high-functioning healthcare system. I want to personally thank you, Minister Copping, for your visible leadership on the important and necessary transformation of continuing care across the province. By investing in modernizing continuing care homes like Bethany Calgary, the government is strengthening the quality and long-term sustainability of the entire continuing care system. Bethany Calgary's new purpose-built environment will better support the complex needs and enhance the quality of life for our residents. We are committed to creating a home-like environment for those who will live here and a workplace for those that will support our teams to do their best care. The good news is that the Bethany Calgary building we are standing in will remain intact during construction of the new care home. This means that there will be no loss of system capacity throughout construction, and residents will be able to remain in their current homes during the development. The new continuing care home will support Bethany's campus of care model that encompasses physical environment, social connections, health and wellness services, and partnerships with community. We're very excited about that. I also want to share that a comprehensive community engagement process will be undertaken over the next year to ensure Bethany Care Society continues to be a good neighbor and a valued part of the Hounsfield Heights, Briar Hill, and surrounding communities, as we have been for the past 77 years. Bethany looks forward to working with our residents and families, our partners in government, Alberta Health Services, and the community to modernize Bethany Calgary so that we can all support Albertans to continue to age well. I would now like to introduce my sector colleague, Dr. Catherine Chubbs, President and Chief Executive Officer of the Good Samaritan Society.
Thank you, Jennifer. Well said. On behalf of the Good Samaritan Society Board of Directors, our Vice Chair is here today with me, Marlene, our executive team, and all our employees, I am pleased to represent our organization today. Thank you to Jennifer and Bethany Care Society for making this beautiful facility available to us. The Good Samaritan Society is celebrating our 75th anniversary next year. I can't think of a better way to kick off our anniversary than starting construction of the Good Samaritan Village. It's been a goal and a dream and a prayer for the last 10 years. The village supports Good Samaritan's mission of providing Christian hospitality through a continuum of care to those most in need or at risk. Our village will have 280 long-term care spaces in the west end of Edmonton. It will also support our work on equity, diversity, inclusion, and reconciliation, which is a huge strategic goal for our organization. The village will offer culturally supportive spaces for Indigenous residents, families, and employees. From the physical design of the building and the property to programming and care within it, Indigenous residents and their families will feel safe and supported in our village. I want to also thank Minister Copping and the Government of Alberta for approving the funding and Alberta Health Services for their continued support. And of course, thanks to God for answering our prayers. I'd like to now introduce Jennifer Mans, Site Administrator for Bethany. Thank you.
Thank you. Good afternoon, everyone. It is an honor to be here with you today. Helping others and making a difference is the reason I chose a career in nursing, and I've always considered it a special privilege to work in continuing care. Here at Bethany Calgary, our team focuses every single day to support our residents and their families and provide the very best in safe, compassionate care. The environment where we provide that care makes such a difference. A new modernized Bethany Calgary will create spaces that will let us continue to provide that high standard of care and support. But with a redeveloped Bethany Calgary, we will be doing so in an environment that is purpose-built for the care and special programming that our residents require. Bethany Calgary is our residents' home, and we definitely think of it that way. But the new Bethany Calgary will be much less a facility and much more a care home. A home that better aligns with the care we are honored to provide. We are incredibly excited about the future for our residents, their families, and our staff and our care teams. Thank you. It is now my privilege to introduce the chair of the Bethany Care Society Board of Trustees, Dr. Al Kriske.
Hello, everyone. As board chair of Bethany Care Society, I'm pleased to be here today to acknowledge the significant impact of today's announcement. The last few years have been tremendously challenging, not only for residents in continuing care and their families, but for our healthcare teams who have provided exceptional care and quality experiences in spite of those circumstances. Today's announcement is welcome news for Bethany Calgary Society. On behalf of the Society Board, I want to extend our appreciation to the Government of Alberta for today's funding announcement. Your commitment to strengthening the quality and long-term sustainability of the continuing care sector has come at a critical time. Throughout our history, Bethany Care Society has been recognized as an exemplary provider of long-term care locally and provincially. We have done so at Bethany Calgary for over 7 decades. We want to continue to serve the Calgary community for many years to come in a new, modern care home. We are very excited about the next chapter in our history that will see Bethany Calgary ready to meet the future needs of Alberta's families. Minister Copping, we are grateful to your government for this funding. which provides another milestone for our province as Bethany and other providers work together with government to shape the future of continuing care. And I echo Jennifer's comments. We are deeply appreciative of your personal commitment to our sector, the people who work in it, and most importantly, the residents and families we serve. We're proud to have your partnership as we live into our vision at Bethany to lead the transformation of Albertans aging well. And thank you all for coming today.
Thank you, everyone, for joining us today. We'll begin the question and answer portion of our announcement. Any questions from in the room? All right. Operator, do we have any callers on the line?
There are no questions in the queue at this time.
Thank you very much. That concludes our announcement today.